So this is our last Tuesday webinar for the ongoing academic year, and today we have the honor to host Margaret Kaseje. Professor Kaseje is the CEO and Director of Research and Programs at the Tropical Institute of Community Health and Development in Kisumu, Kenya. Her talk will be about the impact of climate change on health, particularly in Africa and in vulnerable populations. We will take some questions at the end of the talk. Mathilde will circulate the microphone in the amphitheater, and I will manage the questions online. Please, online, feel free to use the chat to ask your question. I will have a look, or just ping me if you want to ask the question yourself directly. The seminar is being recorded, and we will post the seminar then on the school YouTube channel. And now, please, Professor Kaseje, the floor is yours.
Thank you very much, and I welcome all of you who are here face-to-face and those who are online. So today we are going to be looking at climate change, heat, and vulnerable populations. And I'll be looking at overall what climate change really means. And then I will focus now on to vulnerable populations, looking at those people who live in Africa. And then at the end, we'll be looking at some of the mitigation or some of the measures that can be taken to address climate change. So welcome. So I'll look at some of the key definitions that are used in climate change. You know, why are we talking about climate change? It's something that we cannot ignore, especially when it's going to affect the health, your health, our health, health of populations, and especially the health of vulnerable people. So what is the definition of climate change? It refers to the long-term effects or shifts in temperature and weather. So human beings are always carrying out activities, and sometimes those activities are stopped or are compromised because of climate change. Some of the human activities that impact on climate change is burning fossil fuels like coal, oil, and gas. So we end up with extreme climate effects, and these effects can be very negative to the health of the people and even to their socio-economic situation. And some populations are actually displaced from where they're living because of climate changes that take place. Vulnerability, I'm going to be looking at vulnerable populations. So climate vulnerability is where an individual or a group of people are affected adversely. So they experience stresses, something so stressful because of the climate that they cannot operate normally. And usually there are key indicators or signs that show that there is a climate change, like rising temperatures, extreme weather events, changing rain patterns. So globally, when we look at climate change, you can see that it has changed over the centuries from 1880 to right now where we are. The blue is the Icelandic kind of temperature. But then as you go towards 2000, the year 2000, 2020, you can see that the temperatures are really rising. And the rise is very, very great between 2000 and 2020 when you compare to the rise that took place in previous periods. So for instance, in 2021, there was a 1.1% rise in temperature as compared to the 19th century. So this is something that should make us really worried. It means that things are getting hotter and hotter and hotter. So what are the causes? What causes global warming? And this is mainly because burning of coal, oil, and gas. Those are the greatest contributors to global warming, because when these products are burned, then the carbon dioxide, which is released in the air, has no escape route. So it hangs there, and then it increases the temperature. Deforestation, cutting down of trees, which is happening a lot in Africa because that is the fuel that is used by homes and so on. And development, I say development, but not quite development. People are cutting down trees to build houses, to build concrete structures. And once the forests are cut, again, that affects the temperatures. Rainfall patterns are altered. There's drought, extreme heats, and so on. Fertilizers is the other big enemy, where in Africa, more and more people are using fertilizers. You know, the marketing is so strong, where farmers are being convinced that if you use fertilizers, your yield is going to be higher than if you use farmyard manure. So that again is contributing to emissions, that is increasing the weather. So this is just a picture of what happens. The greenhouse effect is what I'm talking about, where the earth is emitting these gases and then there's no escape. The sun is shining. And in the end, we have what we call the greenhouse effect, which now increases the temperature. So now if we look at the map of Africa, if we look at Africa, the heat wave exposure per year is also increasing. So temperatures are increasing more in the central part of the continent. But if we continue, again, if you look at the frequency of heat waves and so on, this has been increasing over the years. And especially in Africa, there is a lot of rising sea levels and increasing temperatures. And again, that is because of greenhouse effects. Impact on agriculture, on water resources, and the ecosystem is, of course, very negative. So again, this map shows that while Africa is only contributing but it's still a percentage, 4.5% of global greenhouse gas emissions, but when it comes to climate change, it is really experiencing a lot of the adverse effects. So looking again at the map, you can see the reds, the orange, and the deep browns are there. You don't see any greens or any yellows, and it shows that the continent is heating up. So weather patterns, if you look at the weather patterns also, that's an indicator of what is happening in the temperatures. 2,000 catastrophic disasters in the past 3 decades. And seasonal rainfalls have been unpredictable. There's more of it. There's more intense drought, storms, and so on. So drought is the major adverse effect that is resulting from extreme temperature rises, followed by floods. I personally am experiencing changes in weather patterns. Last year, I planted soya beans, and the rains didn't come when they were expected to come. So my harvest was like a cup of soya beans, but I'm hoping for better harvest this year because I waited until it started raining, then I planted. We'll see. So rain-related disasters are also increasing. Floods is the highest disaster that happens. And 60% of the disasters that are recorded in Africa is because of floods, followed by storms and landslides. And this affects population. And if the population is already vulnerable for whatever reason, economic reasons, health reasons, refugee wars, and so on, then these climate changes are really going to impact on them. So let's look at the disasters from extreme weather events. So of the reported weather events, if you look at the green, look at the left-hand side, the blue, 56% is because of floods. The second circle, deaths, the most deaths are because of floods. 110 million people, this is as of 2023, were affected by adverse weather events. And that was drought, the brown circle. And then if you look at the other impacts, the economic changes, 92% is caused by floods. And the estimate in this particular study found that 8.5 billion US dollars is lost because of floods in Africa. So what do we expect in the future? I think the future is not very bright, it's very hot. because we are still continuing with our activities that I mentioned early on. We are still burning forests, we are still emitting greenhouse gas. And the result is that we are having longer lasting heat waves. If you look at that map, climate response uncertainty is on the rise. So even if you look into the future, 2100, we are still going to have even more adverse effects because of climate change. So climate change affects health. And here I have some pictures of how the populations in the continent are affected. So Ahero is about, the first picture there, Ahero County Hospital is about 20 kilometers from where I work. So a few months ago, it underwent flooding, and flooding meant the whole place was flooded. Patients couldn't come to the hospital, mothers couldn't deliver, outreaches for immunization, for malaria control couldn't take place. And people are displaced. And this happens on a yearly basis. So one might ask, why do populations not move away from where they're experiencing these disasters? And it's a complicated situation. Move to where? So you find that they're trapped in this situation where they experience flooding, health hazards, cholera, and so on, and they don't have a way out. So vulnerability is really increased in the case of climate change impacting on these communities. So such communities really experience a disproportionate burden. They're already burdened because they're poor, they're burdened because they live in really horrible housing, they're burdened because they can't afford healthcare and so on. And then there's this additional burden of climate health impacts. So communities really experience these as stressors. You know, they are stressors to their situation. And the extreme stressor is poverty, where now poverty is something they cannot get out of that poverty cycle. And the World Bank has estimated that the population, 40% of the population in the continent lives with under $1 a day, which is really poverty, especially the slum populations, where they cannot afford to have clean water, they cannot afford health services. So their situation is desperate. So again, who is vulnerable? If we look at this, refugees, women, young men are increasingly becoming vulnerable in the continent. The continent has a higher population of young people than the elderly. So we have about 60% of the population in Africa are young people, and they're getting desperate. They've gone to college, some of them, they have degrees, but they don't have jobs. They're living with their parents. Does that sound familiar? So they're not independent, and they don't have livelihoods. So really, they are vulnerable because when the climate affects the household, they too are affected. People with disabilities, children, rural populations are always disadvantaged. So when climate effects come on board, they are even more disadvantaged. Elderly, the less mobile, these are affected by populations movement due to climate change. So this is an example of a cyclone that happened in Mozambique. And Mozambique continues to have cyclones every now and then. What happened was in March 2019, they had a cyclone that followed closely to another one. And rain, strong winds, and flooding displaced almost 500,000 people. And over 1,000 people died from this situation. Health-wise, there was a cholera outbreak. Health facilities were destroyed. Training facilities destroyed. Essential health services could not take place. And this now contributed to the long-term effects of how the system could even recover and even provide services. Socioeconomically, the infrastructures were damaged. So even rebuilding that would take money. And where would the money come from? Government doesn't have money to keep on rebuilding. Agricultural losses, very drastic, that leads to food insecurity, businesses, livelihoods, and of course, increased poverty. So I'm going to just, for a brief moment, look at one of the vulnerable groups that are very much affected by climate change. This is women, pregnant women especially. So last week, the picture on the left is of a woman in Kenya. She's trying to make a meal, and she's using a charcoal stove, which means a tree must have been cut. And that's what she has. She has a pail of water, so she has to be very careful how she uses that water and not waste it. There was a cholera outbreak. 18 cases had been confirmed last week in Kenya, just one part of Kenya. Cholera cases were happening, and it is because of the climate changes, reduced water sources, reduced livelihoods, and so on. So for a pregnant woman in Africa, it's really a painful situation. To be a woman in Africa and to be pregnant is a high risk situation. So for the pregnant woman, she'll have to bear some of these physical challenges, tiredness, dehydration, unable to really perform the work because of the heat, social isolation in some cases. She most probably have other children that she needs to take care of. Psychologically, she's mentally challenged. Economically, she's not in the best situation. We have a social security system that is supposed to work, but in reality, sometimes it doesn't work. So people have to reach into their pockets to pay for even essential antenatal care. So such a vulnerable person would be very much affected by any climate change that happens. So I want to ask you for a few seconds, have you noticed any recent weather events in your area in the last 1 month? And you may think about it or chat to your neighbor. What were they? How have they directly affected your daily life activities? Just 30 seconds. So I'm sure all of you have experienced some climate activity in your life that disrupted your life to one extent or another, and maybe in a safe place. Now imagine somebody who is not in a safe place, but experiencing these changes, and they have to do something about it. So here I have a framework which is very useful, climate change related health impacts in Africa, and it's talking about things that are really influenced by climate change, floods that I've mentioned, storms that have happened, like in Mozambique, storm impacts, wildlife fires that happen, mental health, something that probably is not realized, but mental health is becoming an issue because, and it's related to climate change, because people are affected by the climate change. Heat-related impacts, social health impacts, infectious diseases, which is very common in the African continent, very much impacted by climate change, and non-communicable diseases, which is also on the rise, very much impacted by climate change, maternal and child health, very much impacted by climate change. So if you remember some of the vulnerable groups that I mentioned earlier, all these things at one time or another, they will undergo these climate related factors. So what are some of the mitigation or measures that can be done? And I'm looking at local, national, and international measures that can be done to try and do something about climate change. So at the international level, of course, we have the WHO, the World Health Organization. They are, for example, just looking at infection risks. They estimate that 4 billion people are at risk of infection. And this figure will continue to rise. All kinds of infection related to climate change. By 2050, 5 billion people will be at risk of infection. And so WHO, as a mitigating factor, has come up with strategic plans. The way WHO works is that it works with member states in different countries, and they sign up to frameworks or to plans. So they had this plan, this global strategic plan, to look at some of the diseases that are caused by environmental changes. And this plan is happening until this year. So at the end of the year, hopefully something would have been done to look at, for instance, infection from mosquito malaria and how communities are engaged. That's at the international level. Another thing which WHO has done, which is very interesting, is for some of you who have been looking at the health system, WHO usually has 6 pillars of the health system to guide how it operates. So the 6 pillars, it's looking at medicines, at the human resource, looking at leadership, and so on. So it has tried to bring the issue of climate change to all these different areas. So for leadership, what is the leadership doing about climate change? For medical equipment, medicines, and I'll look at one example, what is happening in relation to climate change. So this is a very useful framework. If some of you want to even use it as a framework for your research, looking at health systems and how health systems relates to climate change, one could use this framework to guide your questions. So now one area at the national level, there are several groups that are looking at the national level. For instance, hospitals. Hospitals actually are partners in crime when it comes to greenhouse gas emission. So there's certain groups, for instance, the Healthcare Without Harm is a group that is looking at how chemicals, plastics, and any pharmaceutical products in hospitals, how they can be produced ethically and environmentally friendly, how they can be disposed in the proper way, and how they can, how much energy, and how is that energy produced in terms of the hospitals. Another group, Global Green and Healthy Hospitals, is looking at more or less the same things. How can hospitals be responsible when it comes to climate and health? Another group, Healthcare Climate Council. So these are global groups that are trying to work with national groups to come up with healthy practices, especially at the hospital sector. So the health sector globally contributes 4.5% of greenhouse gas. Health sector. In Africa, yes, we contribute maybe 2%. And arguments have been, if Africa is producing such a little percentage of greenhouse gas, why should we be bothered? But 2% is still a percent. And if we are not careful, that can also increase. And the more we increase, it increases to the overall percentage on this issue. Now, just zeroing in on the health professionals, if you look at the right-hand side, there was a survey asking them if they'd experienced any health adverse effects. And of course, most of them had, but I want you to look at the brown pinkish bars. What is the expectation in the future? Are they likely to see more people coming to them for treatment or for care who have undergone healthcare adverse effects because of climate change? And most of them said yes. They are likely to see people who have been affected by health-related illnesses or mental anxiety or physical adverse effect because of health of climate change. So it just shows that health professionals are key. They are key in this area of climate change and trying to change the way that people think about climate change, the way they react to it, and the measures that they take. Most health professionals are people rely on them for information. People trust them. So they could be one key sector that can be used to talk more about climate change. So this is an experiment, qualitative research that I did in 2023. And we just went out to find out from people what they thought about climate change. Is it something that people realize, especially in the rural areas, was our question. Do they realize that the climate is changing? Yes, of course they do. So some of the key things that they mentioned, it was a qualitative FGDs and key informant interviews. They mentioned food insecurity and malnutrition that had increased over the time that they knew some years back. Some even mentioned the time that my grandmother was feeding us, this did not happen. So that was like 20, 30, 40 years ago. Increased sickness, the need for health education. The farming sector was very much affected. Less food production. Air pollution, they noted that. Afforestation was needed. Drought was one of the things that they mentioned. So these are the themes that just came out naturally from conversations with community members and key stakeholders. Some of them were just ordinary housewives, farmers. Some of them were healthcare providers. But the fact is they noted that the climate had changed. So one of the things that we really need in Africa is more research, more data, because we don't want the population to experience negative things and not realize that some of these things really arise from the changes in climate. So this is an example of a research group that was undertaking this information collection in another part of Africa, West Africa. And their objective was that they needed to find out what the health impacts were due to climate change. So they also needed to collect data, collect information so that they can use that information to help people, the decision makers, to decide on what best to do. So they used a quantitative method. They were looking at pregnant women during pregnancy. What were their experiences during pregnancy and after childbirth, and also on the child, and looking at the climate impact, climate change impact. So the study was to look at the impact of extreme heat, like in their daily activities. Did they use the health services during this time? What about the health workers? How did the health workers react to them? Were they ready to help them? What were their reactions, and so on? Did they, how was the performance of the health workers during this period? And also the risk. How did these people, these women, what were their perception? Did they realize that actually they were at risk of climate change impacts on their health? And what kind of coping mechanisms did they address? So this was a co-design. The approach was a co-design where one is implementing after designing together with the key stakeholders. You come together, you design, and then you decide what to do. And they implemented this study, came up with findings. I don't have the findings here, evaluated them, and they were able to disseminate how best to help a vulnerable group like pregnant women during heat stressors. So where are we? Yes, impact of climate change is on the increase. We need early warning systems, especially for the continent. We shouldn't be on the reactive mode, but we should be proactive and know and even monitor and be ready for any alerts. We need to coordinate more regionally. We need to work more. Africa is kind of separated. We have the Francophone and the English, and they don't want to work together. I don't know where that war started. But when we have such challenges, there's need for more coordination and collaboration. And of course, the governments need to also step up and do something. So these are just references that are relating to what I was saying. And merci beaucoup. Thank you.
Thank you, Margaret. Mathilde, obviously, I don't know if there are questions in the room because I'm not here, but we do have a question online. So if you want to pass the microphone in the amphitheater, please do. Otherwise, I can share the question which is online.
Okay, we can start with the first question, the amphi, and then the question online.
That's perfect to me.
Hello. Thank you so much for the presentation. It's really amazing to see the comparison of it all. I am also interested in climate change and health, especially in my own country, in Indonesia, and also in Southeast Asia. Oh, by the way, my name is Dila. So what I want to ask is, I see a lot of similarities. I think this pattern is the same across a lot of countries that is in developing period of their timeline, but also most impacted by climate change, even though they don't really give a lot of contribution to carbon footprint in the first place. So what I would like to ask, like you said, it is important to encourage mitigation efforts in health sectors, even though we contribute not much compared to the other sectors. But what is your opinion in a way that in a lot of countries affected, the budget is very much limited. And in a lot of healthcare department and sectors, eventually they will start to push more only on adaptations and not so much on the mitigations. And how do you suppose these two should be balanced in a way they can react to the current events, but also prevent more, the increase in temperature? One other question, if it's allowed, is in terms of health co-benefits, what I'm seeing right now, from my understanding, of course, correct me if I'm wrong, is a lot of climate change adaptation in countries that signed the Paris agreements. They mention health co-benefits, but they don't really put emphasis on the role of health sectors in itself and how to quantify that health benefits within other policies in the sector. So we are very much isolated in terms of climate change actions. What do you think about it, and is it the same in Africa? Thank you so much.
All right, so thank you about adapting, mitigation. That's always a problem. You know, what can be changed, what resources can be brought on board. I think the end result, even to your second question, is just how willing are governments, how willing are they to put in resources to what needs to be done. Climate change seems to be like the new, let me say, the new kid on the block. You know, they're more used to other health interventions. So climate change is still a bit out there, and they're not really convinced. That's why I was saying that we really need more data to support whatever position we are taking. So for instance, the Paris Agreement, I think that was signed by 190 something countries in 2016. The question would be, how far have people, have they really implemented that? So sometimes these agreements are very nice. You know, they're put out there, they're signed, there's a lot of PR and flashing cameras, but on the ground, if it is not followed up, and if it is not an agenda of the country, then it will not go anywhere. So for example, in Africa, we signed the Abuja Declaration, which is almost the same thing, that 15% of the GDP of each country that signed on that agreement would go to the health sector. In most of the countries, they haven't even reached 7%. And this is years and years after that signature. So it's the resources and resource allocation to the health sector.
Guillaume, you wanted to take an online question first?
Yes, actually, the question was very related to this previous questions on adaptation and mitigation. So, in short, the question was, how can Africa become independent and developed while integrating carbon neutral into its policies? And I think that again, the question is, we know that most of the emissions are emitted in the global north and in rich countries. And what's your take on the effort that Africa should invest in mitigation when there is so much things to do at the adaptation level? And yeah, so very related to the first question, but maybe with a different angle.
I think Africa cannot just sit back and say, oh, we only contribute 2% to the greenhouse effect. Even that 2% is a contribution. And it goes back to health and politics. How much are the leaders, the politicians, the ministries of health, the budget, the minister for finance, how much are they committed to the climate change? We can do our little bits at different levels. I mentioned national, local levels. But at the end also, we just need that bigger advocacy and bigger attack, if I may use that word, to climate change so that big impacts are achieved. So both are needed, mitigation, adaptation. We need all of those at the same time.
Okay. My questions, I have two questions, by the way. The first one is about migration. You mentioned that displacement is one of the major effects of climate change, and it is very difficult to find, areas where to put these people. But I'm just it's very difficult to implement, but I'm wondering if it's still part of the strategies in all African countries. Another is, it's related to Dila's question. I also believe, like many other environmental activists, that many low-middle income countries are suffering more from the effects of climate change, despite having very little to no significant or insignificant maybe contribution to greenhouse gas emissions, carbon footprints. And usually the interventions coming from consultants, maybe European agencies as well, or agencies in high-income countries, are focused mostly on social and behavior change. That it seems that you are just putting the burden on the victims of climate injustice. What are your comments on this? Should we focus more on international cooperation, collaboration, instead of focusing too much on changing the behaviors of people?
We need both. That's not a political response. We need both because we can't increase the problem by avoiding social, behavioral issues that can be done. Even the small things that can be done, let's do them. At the higher level, political, that one is also needed. And the more we can advocate for climate change and practices that promote a cleaner environment, the better. And I hope that those people from the higher income countries will be willing to walk along with us. Yeah, we need more collaboration, more working together. Yeah, it's the planet. Somebody said, where else can we go? It's one planet and we're all in it.
So my question is about afforestation. So afforestation is proven to decrease the negative effects of heat waves and help also like mitigate the risks of floods and so forth. And you said in your presentation that especially in Kenya, like a lot of trees are cut down for cooking and so on. And in Africa, there's also this project of the Green Belt to mitigate the desertification of the Sahara Desert. So, but also like if afforestation is not done correctly, it can cause harm. Like recent studies in Austria have found that Austrian forests, where I'm from, are actually at this time emitting more CO2 than they can take. So I was wondering how projects in the African continent and maybe especially in regard with Kenya are going. And yeah.
Yeah. So forestation is a big drive. Our leaders are for it. And I think our leaders got money from the UN to plant millions of trees. So we are busy planting trees right from households and schools and groups, community groups. So we're in the phase of planting trees with the hope that that will now help in mitigating climate change. We haven't reached the stage of seeing the negative sides of it yet.
May I go?
Yes.
Okay. So you're referring to the continent in like a very singular way. And this also could be because of the context of this conversation. But I imagine coast to coast, north to south, there's a lot of different issues going on. But do you think that there is an approach to kind of politicize and to let's do the laws and let's go about it this way and policing the farmers more, and you can't use these fertilizers and this and that, even though there's so much variation of the needs? Do you think that most of the climate change push is coming kind of from this higher government side because the people aren't necessarily looking for it, because the people have different needs that it feels kind of imbalanced? Because yes, it would be great if we all participated in this climate change push, but it seems like it's not realistic for looking at it from a very broad top-down view. So I guess that's not really a question, but a comment. In your experience in working with communities of vulnerable populations, how are you getting them to, yes, okay, let's do this, let's change this way? You mentioned the qualitative study with the pregnant women, but can we have more examples? I guess that would be helpful.
More examples. I think in my presentation, I presented the work I did last year with communities where it was a conversation. It wasn't a directive. It wasn't saying you must do this or that. It was a conversation. What have you seen? What changes have you seen in the climate? And they were coming up with the changes they've seen. So usually in a conversation, a dialogue kind of process, you talk about what the situation is. Then you go to the next stage. So what is really happening? If you only got 5 sacks of grain this year, and 2 years ago you got 20. So what do you think is happening? So it's a conversation where it's not a top-down directive or anything. So from that emerges certain things that they agree are happening in their situation. So from there on, the next step is, so what can we do about it? You know, should we continue planting? Should we use manure? Should we use fertilizer? It's a conversation. So in that way, you take into context the variations of the communities. Yes, Africa is huge. It's not one country. It's not one people. But taking that down approach, down going up, is the best to come up with realistic solutions.
Yeah, thank you. And thank you for passing the mic. So I think that my question is more about when we talk about climate adaptation, because I'm from Nigeria, right? And I'm really concerned about who makes the decisions, and then where are the resources and whose voices are heard, especially when we go to conferences like this, the COP conferences every year. I'm really, really concerned about what actually happens in the room. So I think my question is, how can we ensure that, you know, the climate adaptation processes doesn't reproduce colonial structures or top-down structures, particularly in African communities? Because over the years, more and more, we talk about the impacts of climate, particularly in the continent. And even though we do not produce, you know, we have just 2%, I mean, from your lecture, but then we suffer a lot. For instance, just this year, there has been flooding in Lagos and also in Kaduna, and this has killed a whole lot of people. And then we continue to see the impact of this climate change, particularly in these vulnerable populations. So it's really a concern to actually think about when we want to talk about the solutions to these things. What do we need to do to make sure that our voices are heard, and also to make sure that these solutions are not passed down from, do not have colonial legacies or top-down approach within African context. Yeah.
Yeah, I like your voice. That voice is what we should hear more of,
Okay.
especially the voices of young people. What are you saying about the situation? What means of communication are you going to use to pass around the message? I think the young people can be more active and proactive in coming up with solutions about this whole problem. Too often, I think the young people feel, oh, we don't have anything, they won't listen to us, it's only the elders, and so on and so on. Come up, rise up, and take your position, because this is something that all of us need to be engaged in. I know what you're talking about, but don't step back. Right now, a lot of countries in Africa are realizing the participation, the importance of having young people participate, even having young politicians, parliamentarians, young people in every sector, so that they can also be part of this solution. I think we've reached a stage where we should move from the colonial excuse. I think it's now becoming an excuse. That happened, yes, we know it happened, but what are we going to do as the next step?
We can take some online questions.
Yes, there is a question by Zaka about the Abuja Agreement, signed as an equivalent of the Paris Agreement. And the question is about the measures in place related to this agreement. Because, so sorry, I'm trying to ask the question properly. The agreements say that instead of 50% of allocation of resources, so the GDP, we haven't passed the 7%. And if Professor Kaseje could elaborate on, yes, this agreement and like the overall process.
The Abuja Declaration was signed some years back, about 20 years ago, by African countries that committed to make sure that they had enough resources for the health sector, because it was realized that the continent was suffering a lot, especially from infectious diseases. And if something was not done to make money, basically money available to ministries of health, then not much would happen. So they signed and they said that they would give at least 15% of their GDP to the health sector. But as I speak, very few countries, maybe 2 or 3, are giving 15% of their GDP to the health sector. Most of them are at 5%, 6%, 7%, meaning that the health sector is not getting enough finances to do what it needs to do, to train doctors and nurses, to get pharmaceuticals, medicines, and so on, to build infrastructures, health facilities, and so on. This is why the health sector in Africa is so fragile. So any little shaking, even from climate change effects like floods that comes and wipes away the hospital, that one is going to have much higher impacts on the health of the people, short-term and long-term. I don't know if that answers the question.
Well, it was online, so it's difficult to be dynamic on the exchange, Professor
Right.
Kaseje, but
So let's
I have another feedback about a
Yes.
potential demographic issue online also. So can you elaborate on this and maybe the intrication between climate change, demography, health, and also like the diversity across Africa? Because as it was asked before, situations are different in the continent.
Sorry, I didn't get that.
Okay, about the issue about potential issue around demography, and I guess the question is about the increasing numbers of population in especially in some countries.
Right, demography, I mentioned that most of the population in Africa are young people, meaning they are in their up to about 30 years old. You're young in Africa until you get married. So yeah, a lot of the people are still young, meaning they are still early in their careers, or they have not really settled. They're still in school. They're still dependent on adults, and that puts a strain on even the resources of the continent, in addition to other strains. So climate change is going to have a higher impact because it's impacting populations that don't have economic independence.
Thank you. And maybe a secondary question on top of the one you already started to answer, but the explicit question of Zaka about the Abuja agreement is basically, how do we ensure that the agreement will be respected and followed?
Abuja agreement, just like the Paris agreement, is up to the governments to make sure that they implement them. There's nothing else to it. They just have to do it and provide the resources to implement.
Hi, Prof. Margaret.
Hello.
Thank you for your talk over here. I just want to go back to the question Rafiat mentioned and the conversation about participation. And I was wondering if you have any tips or recommendations in terms of how to counteract participation fatigue, because you know how I understand that policy is the long game and changes don't happen overnight. But then sometimes, like I'll speak personally, that I can get discouraged when it comes to advocating and pushing for change, and it takes so long or you're ignored. And speaking to young people who easily get discouraged, and there's so much happening in the world, and 1 minute it's this and the next it's that. How do we overcome feeling tired and discouraged from the slow pace of change?
Yeah, change takes time. But I think I find that the young people are more in touch through social media. Very quickly, you can exchange ideas and network and connect. You're on the internet. That means information is more on your hands, and you can know what's happening within seconds. So you're more in touch. Of course, that's also a strain because then there's too much happening. But I think that's an advantage you can use to mediate, to advocate using medias that are available to you. And working with mentors is one thing. Mentors can walk with you through the change process. So finding the right mentor is part of making a successful process towards advocacy. I think about my mentors. Sometimes I didn't realize they were mentors, but they were mentors, and they pushed me through gates and allowed me to be present in certain situations that pushed me to the next level. I think mentorship is very important.
So I was the one who asked the question online, like the one about.
You were online?
Yeah, I was in the office, but I got that my question was not well transmitted, so I rushed quickly to explain. So so I'm Zaka. I'm from Ivory Coast. So I do understand that like the agreement of Abuja was signed, but as you mentioned, like so far, no one is doing quite well. So the question is like, what do we do to hold them like accountable? Because we cannot be signing only things without having things done. So, because most of the time after signing, for example, the Abuja, they will go and sign another one and things will be signed and so on. But if we don't hold them accountable, like how do we move on, honestly? Like, so do you know any ways that in Africa we are trying to hold them accountable? That's my question.
I wish I knew the answer. Unless there's change in leadership, in the way governance happens, I think it's going to be, still very difficult. We need younger leadership that are comfortable with change, that are comfortable with challenges, because the older group don't like to be challenged. They don't like to be criticized. So I think we need a change of generation in leadership to yes. Yes, and that's happening in some countries, yes, where NGOs and small groups are doing things, and the lessons learned, they make sure that they share them with the leadership, with the government. And there have been examples where the government has taken up these ideas if they're presented in a positive way and has changed things. So whatever you do, you don't have to be in the one line vertical government line. You can still be doing your interventions along the side, but find a way of how you communicate to the government on the best way to carry out these things.
Thank you for your talk. As you mentioned, we have had the same situation in Iran. Flooding has increased, and the poorest provinces were the most vulnerable ones that were affected. And also we have somehow global warming related conflict somehow starting. But again, somehow similarly, the government doesn't have or don't prioritize funding these kind of problems, solutions for these kind of problems. So what I've seen is that charities get involved and try to somehow make homes for those who have lost their homes. But I'm not sure if all of these are the sustainable solutions that can help somehow empower the population for future. I wanted to ask what you suggest as the most helpful or impactful things that should be done in lack of that governmental action.
I think the best way is to have a partnership, because whether we like it or not, the government will always be there. It's the leadership in that government which will change, but the government as an entity will always be there. And when you think of sustainability, it's only the government that can continue on and on and on. NGOs and small organizations, usually they depend on funding, external funding. So when that funding gets finished, then they wrap up their project and they move away. But if it's possible, if there's a partnership, then the small organizations can contribute, they can support what the government is doing, because government may not be able to do everything. But the realization is we need to find ways to advocate with the government to make sure that they take the critical areas, because those are the ones that will need to be sustained. It's difficult sometimes because government and NGOs, sometimes they don't agree, but if they can be a go-between to help that partnership work, then I think that will be the best. Especially now, because funding also is not always assured. So NGOs may have funding for 3 years, 4 years, and then that ends. But the government somehow, if it can work within its budget to make sure that critical areas continue, let's say in the health sector, then that would be the best way forward.
So I think you've just answered my question partly, but then it was more about, so climate change in itself is an area that cannot really work with like one government working on it. It is supposed to be intergovernmental. It is supposed to be a lot of partnerships working in that region, and everybody's supposed to work together. And agencies like IPCC and others were working towards that intergovernment link. And that in that linkage, the fundings were flowing from US, as we understand. It was, I think, I'm forgetting the right numbers, but then I think it was a 200% jump in funding from the US between 2021-22, and then in the last IPCC report, it was still required that there is a 300% more that we require to sustain the present efforts. So with the present funding cuts, do you think, maybe this is controversial, but then do you think climate efforts are going to take a backseat in the next few years, or you think there are other players that are coming in to fund research, to fund these intergovernment links and everything else that's happening around it?
In my opinion, I think climate change may take a backseat because sometimes you need funding, sustained funding at a certain level to push a new agenda, and climate change is a new agenda. So unfortunately, it may go on, but in little pockets, my opinion.
Thank you very much. We are now on time. That was a lot of very dynamic seminar with a lot of questions and a lot of discussions. Thank you again, Professor Kaseje. Thank you for the one in the room. Again, the seminar will be posted online in the following weeks, so you will be able to see it again on YouTube and to share it if you want. And the upcoming webinars will be announced for the start of the new academic year in some weeks. So thank you again online and in presential in hand.